The pancreas is an organ that produces enzymes that help with digestion and hormones that regulate blood sugar levels. It is located in the upper abdomen behind the stomach. Pancreatic cancer occurs when cells in the pancreas begin to grow out of control. This can lead to a mass or tumor that may be cancerous. Pancreatic cancer is a challenging disease to diagnose early because it often does not cause noticeable symptoms in its early stages. By the time symptoms do appear, the cancer may have already spread to other parts of the body. However, there are some early signs and symptoms that, if recognized and addressed promptly, could potentially indicate the presence of pancreatic cancer. These early indicators are crucial for early diagnosis and treatment. In this video, we will discuss 6 early symptoms of pancreatic cancer that you should never ignore. If you notice any of these symptoms, it's important to consult with your doctor and get tested as soon as possible. Remember, early detection and treatment can significantly improve outcomes for many individuals diagnosed with pancreatic cancer. Number 1, abdominal pain. Abdominal pain is a common symptom of pancreatic cancer, especially in its later stages. The pain is often described as a dull, constant ache in the upper abdomen. As the tumor grows, it can put pressure on nearby nerves and blood vessels, causing discomfort. The International Journal of Clinical Oncology published a study that looked at the relationship between abdominal pain and pancreatic cancer. They found that persistent abdominal pain was present in 72% of patients with pancreatic cancer. Additionally, the study found that the severity of pain was correlated with the stage of the disease. Early-stage pancreatic cancer was associated with mild to moderate pain, while advanced-stage disease was associated with severe pain. If you experience persistent abdominal pain, it's important to see your doctor. While abdominal pain is not a definite sign of pancreatic cancer, it is a symptom that should never be ignored. Number 2, jaundice. Jaundice is a condition that causes yellowing of the skin and the whites of the eyes due to a buildup of bilirubin, a yellow substance produced during the breakdown of red blood cells. It can be a sign of several different conditions, but it is also one of the earliest and most common symptoms of pancreatic cancer. When pancreatic cancer cells grow and spread, they can block the flow of bile from the liver to the small intestine. This blockage causes bilirubin to build up in the bloodstream, leading to jaundice. According to a study published in the journal HPB, Surgical Management of Hepatobiliary and Pancreatic Diseases, approximately 40% of patients with pancreatic cancer present with jaundice. If you notice that your skin or the whites of your eyes have turned yellow, it is essential to seek medical attention right away. Early diagnosis and treatment of jaundice associated with pancreatic cancer can improve patient outcomes. Number 3, weight loss. Unexplained weight loss is another potential early symptom of pancreatic cancer. It has been estimated that around 75% of patients with pancreatic cancer experience significant weight loss, according to a study published in the Journal of Clinical Oncology. This weight loss is often unintentional and occurs even when the person is eating normally. There are 2 main reasons for weight loss in pancreatic cancer. First, the tumor itself may cause the body to use energy more quickly. Second, pancreatic cancer cells may produce substances that interfere with the body's ability to absorb nutrients, leading to malnutrition and weight loss. If you have lost a significant amount of weight without changing your diet or exercise habits, it's crucial to talk to your healthcare provider. While weight loss alone is not a definitive indicator of pancreatic cancer, it is a symptom that should not be overlooked. Number 4, changes in stool. Changes in stool, such as a decrease in stool volume or an increase in the frequency of bowel movements, can be an early indication of pancreatic cancer. This is due to the fact that pancreatic cancer can obstruct the flow of digestive juices from the pancreas into the small intestine. Without these digestive juices, the body has difficulty breaking down food, leading to changes in bowel habits. A study published in the journal Pancreatology reported that 25% of patients with pancreatic cancer presented with digestive symptoms, including changes in stool. Additionally, the stool may float or have a pale or clay-colored appearance due to the lack of bile salts, which are necessary for normal stool formation. If you notice any unusual changes in your stool, it is essential to consult with your healthcare professional. Although changes in stool alone do not confirm pancreatic cancer, they should not be ignored as they may indicate an underlying issue that requires attention. Number 5. New onset diabetes. The pancreas produces insulin, a hormone that regulates blood sugar levels. When pancreatic cancer develops, the cancer cells can damage the insulin-producing cells in the pancreas, leading to a decline in insulin production. This can result in a new onset of diabetes or a worsening of pre-existing diabetes symptoms. A study published in the American Journal of Gastroenterology found that approximately 15 to 30% of patients with pancreatic cancer had newly diagnosed diabetes. Furthermore, the study noted that the development of diabetes after a diagnosis of pancreatic cancer was associated with a poor prognosis. It is essential to understand that not everyone with newly diagnosed diabetes has pancreatic cancer, but if you or someone you know has developed diabetes, especially type 2 diabetes, and has no other risk factors, it is crucial to consult with a healthcare provider. Early detection and treatment of pancreatic cancer can significantly improve the outlook for many individuals diagnosed with this condition. Number 6. Back or side pain. Back or side pain can be an early symptom of pancreatic cancer, particularly when the tumor is located in the head of the pancreas. The pain is usually a dull, aching sensation that occurs in the upper back or in the right shoulder blade area. This type of pain is often constant and may worsen with eating. Additionally, the pain may radiate to the abdomen or the right side of the body. According to a study published in the Journal of Gastrointestinal Cancer, approximately 10 to 30% of patients with pancreatic cancer initially presented with back pain. While back pain alone is not a direct indicator of pancreatic cancer, it is a symptom that should not be overlooked, especially when accompanied by other potential warning signs. If you experience persistent back or side pain, it is essential to seek medical attention. Early detection and diagnosis of pancreatic cancer are crucial for effective treatment and improving patient outcomes. Conclusion. Pancreatic cancer is a challenging disease to diagnose in its early stages due to the nonspecific nature of its early symptoms. However, being aware of the potential warning signs and seeking prompt medical attention when these symptoms arise is essential for early diagnosis and treatment. Abdominal pain, jaundice, weight loss, changes in stool, and new onset diabetes or back pain can be early indicators of pancreatic cancer. While these symptoms may also be associated with other conditions, it is crucial not to ignore them. If you notice any of these symptoms, it is essential to consult with your healthcare professional. Early detection and treatment of pancreatic cancer can significantly improve patient outcomes. Therefore, it is vital to prioritize your health and seek medical attention when you experience any concerning symptoms. Remember, knowledge is power, and being proactive about your health can make all the difference. Stay informed, stay healthy, and take charge of your well-being today. If you enjoyed this video, please like, share, and subscribe for more informative content. We appreciate your support and your trust in our channel. If you have any questions or comments, feel free to drop them below. Our team of experts will be happy to assist you. Thank you for watching, and we look forward to bringing you more informative videos in the future. Stay well and take care.